Hello and a very good evening to all our viewers who are joining me in this live interaction session of News 9's Facebook as well as YouTube page. Now, Karnataka expert team is all set to study the high-risk patient data. Well, it has been over 6 months since the pandemic spread like wildfire across Karnataka and also across the nation. And even though it has been so long since the first case was reported, there is still very limited data available about the virus, the treatments to reduce the intensity of the viral infection, aging, and also fatality. So in order to get more insights about the COVID-19 and also how it affects people, especially those under the high-risk category, a group of experts from Karnataka's critical care support team that treats and also monitors high-risk patients will study several months worth of data on such patients and would then publish the findings in a peer-reviewed journal. So the expert team has treated high-risk cases while simultaneously also managing their comorbidities as well. So they plan to publish a journal with studies on COVID, including the analysis of experiences from different districts of Karnataka and also the study data from various hospitals as well. So along with the Rajiv Gandhi University of Health Sciences, this team will study the use of plasma therapy, the effect of medicines used to treat corona patients as well. And this particular study also involves data of about 2 to 3 lakh patients, including those who died, that the team has gathered since its inception in mid-April and is expected to throw light on various issues, bring out observations and also anecdotal case studies as well. Now, to give us more insight about the study, we have with us Dr. Anup Amarnath, the head of Clinical Research and Scientific Review Board of Manipal Hospital, and he is also part of this team, which is all set to carry out this particular study. Many thanks for joining me in this live interaction, Dr. Amarnath. And my first question to you today is there a reason behind why the study will be done around only high-risk patients?
No, I think the idea is to have a holistic look at the entire set of cases that we have treated and supported. The idea is that with anything related to medicine, it's always good to have an evidence-based practice. And with the kind of data sets that we have, almost as you rightly pointed out, lakhs of cases that we've been involved in. So it would give us very good insight into the demographics of the disease, what treatments work, what treatments don't work, and so on. So I think it'll be a good study to look into in order to give us a few more details, but the big advantage is that we would have an evidence-based study.
Now, Doctor, how are you going to process the data of so many individuals and who will be the end users of this particular study?
So with any scientific study, it has to follow certain steps. The first one is the study protocol, how the study is designed, and what exactly the study needs to answer, what questions we need to answer. So once that is done, next it has to pass through something called as the ethics committee. So, and the third step is to get it cleared by a scientific review board. So each clinical study, any scientific study has to follow these steps which I just mentioned before it can get published. So once all these steps are done, depending on what we set out to look for, the answers would come thereafter. So it is something which we have to follow it in a step-by-step manner. And then once the study results come out, the end user is not just clinicians, but also the lay public, because it would give us a lot of insight into how the disease has been spreading, what works, and when you have a team which is monitoring the critical cases, what is the utility of those kind of teams in terms of reduction of mortality, which is deaths, and how intervention timings, how soon if we intervene, the outcomes are better. And anecdotally, what we've seen is that the later the patients come into the hospital, the poorer the outcome. So all these things which we know anecdotally will be substantiated by evidence. So it is important that this data set is looked into in a scientific manner.
Also, Doctor, now what are the factors that form the basis of this particular study?
With any study, as I said, it's the main thing would be the study protocol in terms of what we set out to look into. the demographics of the data in the sense that we already have certain demographic data of which age group of patients are more affected. So the demographics is what we look at. Number two, we would be looking at the treatment modalities. Number three, it will also be the comorbidities will also be looked into. Number four, we'll also be looking into the investigational outcomes in the sense that when you look at COVID, there are certain radiological tests and biochemical tests that we do. How these radiological tests and how these biochemical tests are important in each case and in determining the outcome of the case is also something which we need to look into. So on one side, you get the demographic data. On the other side, you get the clinical data. Then you have the biochemical and radiological data. And lastly, but most importantly, the outcome data. So these 4-5 things would form the basis of the entire study.
Now, Doctor, my last question is, a few years later, when we look back, how important and beneficial will this study be to all, the end users, like you mentioned?
I think it would not be an exaggeration to say that it would be a kind of a landmark study, primarily because, we started off early when the government of Karnataka reached out and set up this expert committee to support critical cases amongst the district hospitals across Karnataka. So I think it is one of the first few public-private initiatives which came up in the best interests of the general public. And then I think it's important that we look at from that angle. So when public-private partnerships can be set up at a short notice and at such vast scale, I think it's important that we need to look into how the outcomes have been. And I think this can be extrapolated to not just a pandemic, but also how PPPs can work out in preventive care, in tertiary care, and things like that. So the outcomes may not just be related to the COVID, but I think there will be far-reaching implications in the broad context of how public-private partnerships can work to the betterment of healthcare.
Right, Dr. Anup, many thanks for joining me in this live interaction. Well, there you heard it from the doctor and also one of the team members of this particular study. And Dr. Anup, along with his teammates, will be analyzing data of close to 2 to 3 lakh patients who are under the high-risk category, who are still awailing treatment, and those who have already succumbed to the disease as well. And he believes that this study will throw light on how public-private partnership will play an important role in not just COVID-19 pandemic, but in general as well. So how awareness can be spread among the public about a certain group of people, their complications, the kind of treatments that they can avail, and also about how people in general can help the people under the high-risk category stay safe from COVID-19 as well. So we wish the doctor a very best of luck for their studies. And if you guys have liked this piece of information that I've shared with you all today, please do drop in your comments, and also like, share and subscribe to News 9 Digital on various social media platforms. Many thanks for joining us.